Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning, everyone. Nice to see you all. Megan?
Nice to see you all. All of us here in the studio.
All of us here and in the audience,
yes,
right?
I
could see. You don't know that we could see through the radios to people and
through the radios.
And the computers and the phones, right? We have that power. No, we don't.
Starting to sound real paranoid.
We really don't.
We can see through the radio.
We cannot, but it's great to see. We can see how many people are with us, though. I could see that we have, several Facebook Live viewers, so that's great.
Yeah.
Anyway, it's great to have everyone with us this morning.
Keep tuning in.
It is Wednesday, May 27th. I always have to say the date, so.
It's helpful.
I think it is helpful.
What is it?
I have no idea.
I was joking. It's March. It's like March 83rd in my head.
Yeah, that's about how it feels.
Yeah.
And I think for a lot of folks.
The world stopped. Yeah.
Yeah. What is this, week 10?
Yep.
Because you are keeping track.
I am keeping track, because Radio Free Saturday morning.
Saturday morning.
This is week 11. We're in week 11.
Oh, okay.
We just finished week 10.
Gotcha.
Yep.
All right. Very good. Well, it's great to have everyone here. We're going to be talking a bit about mental health today with one of our guests, and also a little bit about volunteering with another one of our guests. So it looks to be a great show, and so we have all that to look forward to.
We do.
Exactly. So shall we talk to our first guest?
We should. She's patiently waiting.
She's waiting, and we can see her.
We can. She can't see us, which must be very anxiety-inducing.
Right, exactly. But Sue Hodgeman is going to be joining us, and is joining us right now via Zoom. And Sue, good morning.
Good morning.
Good to see you. I know you can't see us, but you can hear us.
I can hear you. It's not fair that I can't see you. I don't know who I'm talking to.
Well,
I know it's really you.
Take our word for it.
The deeper voice is Scott, and this is Megan.
Yeah.
The woman with Scott.
Right. There you go. So thank you for being a part of the program. And so, Megan, I'll let you kind of start things off. You had some questions, I know, for Sue. And
Sure.
I have some questions for Sue.
Sure. Yes.
Oh, good.
Well,
Yes.
Sue has been teaming up with folks from the community to do a series called Minding the Gap. So I want her to talk a bit about that.
Yes.
Okay. Minding the Gap is a really cool project that was thought up by Jim Crowley of the San Juan County Commission Board. And I think Jack Fortner was in on it too. I'm not sure. But they had this idea that during the pandemic that we could do short snippets on ways to keep people informed and supported during what we're calling this mental health crisis. A lot of people, because they have to stay in, because they have to sequester, quarantine, social distance, it's causing a lot of anxiety, depression, because we are human animals and we need interaction. And so this has been difficult for a lot of people. So with Greg Allen of the San Juan Safe Communities Initiative, who is like a brilliant cameraman and editor, we put together this series of just short takes, maybe 4 minutes of, we're letting the behavioral health providers in the area present on a subject that's near and dear to their heart. We started out with Terry Fortner, who is a nurse practitioner, works primarily with behavioral health. She did a portion on anxiety, what it looks like and how to take care of it in very, very simple and understandable ways in your own home. And with the caveat that you can always reach out. And this kind of, this project that we're doing kind of goes hand in hand with the COVID resource directory that we've got posted on the San Juan County website on the behavioral health page and on the San Juan Safe Communities resource page, and also with the San Juan County Behavioral Health Task Force. They have a Facebook page, and so this list of resources is also posted on that. And so anyway, back to the Minding the Gap, we did a series that Terry kicked off, and we did Monica Ortega with substance abuse during COVID, how to get clean, how to stay clean, how to reach out and get the help you need, how to, access the resource community. Another one was suicide with Dr. Amber Layton. I don't think we've listed that one yet. I think that's the next one coming up because unfortunately, suicide is happening. People get to the end of their rope and they don't have the resources, the skills. They don't have that ability to do the forward thinking for whatever reason. and they attempt it, or they actually go through with it. We're seeing a rise in suicides. We're also doing a section on helping children get through this, because children are watching their parents, and parents are the first and the best teachers of children, and so children are watching their parents and trying to figure out, how do we get through this? What is this, and how do we get through it? And then yesterday we just filmed one with anxiety and depression with Sadie McDaniel of Angel Peak Counseling and Bloomfield. So we've got a few more lined up as well, but it's short, it's sweet, it's skills, it's tools, and it's a way to keep people connected. So
that's great. And so how do I watch these videos again? You mentioned Facebook. Just state that one more time so that we know where to find them.
They're dropped every Monday at 10 a.m. on the San Juan County Behavioral Health Task Force Facebook page.
Got it.
It's kind of a long title, but you go,
That's all right.
San Juan
We can
County
find it.
Behavioral Health Task Force.
There you go.
Right.
And it's every Monday, and then you can access any of them we've done so far.
Excellent. Well, and Sue, talk to us a little bit about, what types of things, I think you mentioned some of these too, during this whole pandemic, how it can affect our mental health and maybe even in ways that we haven't really even thought about, right? As we're staying home and maybe not able to hang out with friends and even family. Right. And, a lot of folks have been talking about how they miss hugs and just those simple things that we can't do anymore.
Yeah. It's been difficult for a lot of people. There's a lot of fear out there, and there's a lot of misinformation. But fear is the driving factor for any of that. And people, many people have lost their jobs, their livelihoods, and they're trying to figure out, how do I navigate this? How do I do this? How do I get toilet paper, for heaven's sakes? Just the whole toilet paper drive was a good indicator of fear operating. And so, when fear steps in, a lot of common sense flies out the door. And, it's nice to have a stable friend that you can go to, but unfortunately they're at their house, you're at your house. If we're fortunate enough that we can have phones, we can keep in touch. If we're fortunate enough we have cameras, computers, we can do Zooms and things like that. But it's really taxed people in their ability to connect. And we know that the impact of just human connectedness is huge on us. I don't think we really realized it up until now, that how important that human connection, that friendship, that checking in daily is to everybody. And so when we don't have those to stabilize us, it really lets fear run amok in our brain. And so, it's really important. There's something on the web about taking 5 every day and contacting 5 people every day, either by phone, by email, by texting, however even if you go out and walk in your neighborhood and wave at 5 neighbors, you've made some kind of human connection. So the fact that we're not connecting as much is really affecting a lot of people. And, people are going through a lot of things. And I'm not even mentioning the whole COVID fear, fear of people getting sick, fear of living in San Juan County or McKinley County, where, we're getting national headlines. But, we have to rely on our fellow human and open our hearts to other people and give that courageousness and that bravery that we have, that it's going to be okay. I don't know how, but it's going to be okay. And I'll help you and you'll help me. But, a lot of us don't know those skills either.
Yeah,
that's right. And so I know that you have a lot of specialized training in addiction specifically, and I've been thinking a lot about habit formation during this time, right? We're now getting used to, and we're getting in certain rhythms, and we're coming on 90 days, which is usually part of habit formation, is that it takes that long to form a habit. So can you speak to some of that as we're forming these new weird habits that we might have to figure out how to navigate after coming out of this? Yeah. What are some things we can do to maybe use this time to form healthier habits?
I think that's a really good idea. We do have to, I suggest getting up at the same time every day, although right now I'm talking out the other side of my face because I did sleep in 20 minutes just because I was tired from yesterday. But I suggest getting up, and I'm just repeating what the experts say. I am no expert. I'm just here to practice. But the experts say get up at the same time every day, create a routine. Like for us, we get up, we feed we let the dogs out, we feed the animals. Then, we of course turn on the coffee, and then I turn on my computer and I get to work. I would like to incorporate some kind of more exercise. Right now, I do my exercise at lunch, and I take a quick 20-minute walk. I've noticed that if I take a 20-minute walk every day around my neighborhood, I feel much better. It activates the endorphins in our brain. So even a short walk, but if we incorporate some kind of exercise into our day and do the same routine, it's been proven that if we have a good routine, it helps stabilize our brain and our mood because we know what to expect. And sometimes, like young children, adults still need to know what to expect. So if we get ourselves on a good routine, we know what to expect, and we start our day out a little bit better.
Understood. And Sue, we have a question on Facebook, and I appreciate the question about, folks who maybe live alone anyway, and now we're living alone. We live alone anyway, but we normally we're social people, and so we come into contact with our friends and family out in social settings. But now we live alone, and we're not coming into contact with people in social settings, and so there really isn't any of that interpersonal connection and contact. And is that something, especially maybe for people, maybe the elderly and shut-ins and things like that, that we should really think about and make an effort to at least reach out to those members of our community?
Absolutely. If we have a phone, we've got to call people. We can call 5 people a day and try to make contact with them. Letter writing is a wonderful skill that's just fallen by the wayside since, we got the internet. I think letter writing, how wonderful is it to receive a handwritten letter in the mail? Granted, it takes longer, but it's a wonderful gift. And I suggest that specifically for, somebody who's very much older and at home, maybe they could reach out and write letters, or people could write letters to them, or just drop by and wave. When I go out on my walk, I see people in their yard, and I make a point of waving at everybody to the point where I think people say, who's that crazy lady out there waving at everybody? But I believe that everybody needs to be acknowledged. So if we know of somebody who's living home alone, it's on us to pay that attention to them, even if it's just going up and waving at the yard or knocking on their door and stepping back and making sure that they're okay. And just stand there for a minute. We have to mind social distancing rules, but we still have to check in. And if we live by ourselves, we can still reach out. And this is kind of it could be a really creative time for a lot of people. What did they say that Sir Isaac Newton developed some great scientific thing?
Calculus.
What was it?
It was calculus.
Calculus.
Yes, and Shakespeare wrote
So he's who we
King
can
Lear.
complain about. Yeah.
Well,
Right.
we can't all be Isaac Newton developing calculus or Shakespeare writing King
Why not?
Lear,
Why
but
not?
we could
all do something.
do
wonderful.
something.
I guess. Okay.
Yeah, exactly.
Okay.
I don't know.
Thank you.
But yes.
Okay. Well,
Yeah.
thank you both for that.
Something wonderful.
Thank you both for that.
And everybody, I believe, everybody's got some kind of deep project, deep wonderfulness, deep creative something. Everybody's got something special, and maybe now's the time to bring it out and to make a plan to release it. I don't know.
Right.
Maybe. Scott, are you going to take up cross stitching finally?
How do you know I don't already do that?
Yeah,
See?
that's a great thing.
But I don't. So
Things
so-
that we can learn about each other.
So no, I don't. I know I won't,
That's
probably.
right.
But there you go. But I think that's good
It
advice.
is.
And
No, it totally is.
and
Yeah.
I
we got to
want-
figure out how to use the time.
We do. We definitely do. And Sue, I wanted to ask you too a little bit about the services in our community. Even though things are shut down, so to speak, there's still folks that are working from home, and there are still services for mental health that are available, right? And if folks feel, because you mentioned all the things that we're dealing with, whether you've got a loss of a job, or maybe someone in your family lost their job, or income is lower, and just the whole pandemic thing and the fear that goes along with that, because
A lot of fear and anxiety, absolutely. Our behavioral health providers have done amazing work in the past 3 months, I guess. Would you say it's been 90 days now or 91
Almost.
days?
Yeah.
80. This is day 83. Trust me, I'm
okay.
counting it down
Wow.
like I'm in a prison cell.
Yeah.
Well, and I've seen her
Okay.
office. It's true.
Little
It's on your
scratches on the wall. Yeah.
Yeah.
Yeah. What I'm hearing now that the behavioral health providers have learned 2 years of technical skills in about 2 months. This epidemic has, the one good thing it's brought is the ability for behavioral health providers now to bill for remote services. And that means telephone services if they do a session over the phone, if they do a session over the Zoom, with the computer screens, if they do a FaceTime session. That's a cool thing because they're able to bill now and get reimbursed for the work they're doing. And so they're able to expand the ability of offering services to more people. Some people really like that too. They appreciate the distance. I've heard that young people who are very technically savvy really appreciate doing a Zoom session or a FaceTime session or something. And so because they can get provided, they can do more services and they can bring in more clients. I'm not hearing that client loads are dropping. I'm hearing that client loads are increasing because people are reaching out and asking for help and for skills and how do I manage this? I feel like everything's out of my control and I'm feeling helpless or I'm feeling really sad and depressed. What do I do? And so they're able to access services. Almost all of our behavioral health providers, of which you can see their names and numbers and contact information on any of the resource lists you go to, are providing services in whatever way that you can do it. Very rarely, once in a while they'll do a face-to-face for a specific client that absolutely cannot do it any other way. And of course they practice all the safe protocols. But the majority of all the visits and groups too now are online and internet and electronic. And so people can access supports and help.
Wonderful. Well, Sue, we appreciate your advice and guidance this morning and knowing that these services are still available in our community. And I think, it certainly is understandable if folks are feeling a little overwhelmed these days and to certainly reach out for help with some of these things that we can provide in our community.
Thank you. I appreciate the time to be able to speak on it. It's one of my favorite subjects.
Well, it's
I hope so.
Great to have
That
you with
and
us.
pulling weeds.
There you go.
Oh,
well,
come
thank
to
you
my
so
house.
much, Sue Hodgeman.
All right. Take care. Everybody be healthy out there.
Thank you. You too. That's Sue Hodgeman, the Behavioral Health Director for San Juan County. That is a relatively new position that
It
the
is.
county
It is.
has created with some funding to meet the needs of our residents. So-
Yes, hence Minding the Gap. There was a
Yes.
huge mental health gap study, actually, that you can also find online that it's helpful to peruse. It's good information, and it's great. It's great to know that the county is taking this seriously and is pouring more resources into it. So,
Definitely. Well,
yeah.
we appreciate that. So wonderful. Thank you, Sue, again. And we will move on with our other information this morning about COVID-19. We can talk about some of the numbers.
What numbers? That's our
Again,
thing.
because again, I believe, at least for the second day in a row, San Juan County had the largest number of new cases in our state yesterday.
It was looking so hopeful last week.
Well, I think they're still lower than they were.
Okay.
So that's still positive. And as we talk about some of the cases here, let me find them, and I'll go to this, and I'll get this
There it is.
fully screen. Yep, we'll go here. And again, as we talk about McKinley County, which of course is the other hotspot in the region, of course, we're kind of neck and neck the last couple of days. But I think San Juan County had one additional case than McKinley County as a part of new cases, but they were in the 20s. And so San Juan County yesterday had 26 new cases. So we've had shows where we've talked about 70 new cases,
We have.
right? And so I think
We
these
have.
numbers are
Yeah.
encouraging.
Well, and we do have more testing. We had testing here at San Juan College yesterday.
Yeah, and again,
Kurt-
tomorrow there'll be
Right.
testing here at San Juan College. Kirtland is today, you're
Right.
right about that. 7 a.m. Information for folks, first come, first served. They'll be here again at San Juan College tomorrow beginning at 7. And so there are the numbers from the state. And so again, we had 5 additional deaths yesterday across our state. We now have more than 7,100 cases. San Juan County had 2 additional deaths now for over 100, and the recoveries are up by 42. So that's the numbers that the State Health Department was sending out yesterday. So again, we were leading the state yet again with that 26 number. Navajo Nation had 48 new cases yesterday and 1 additional death across the reservation. And there's a story again about the testing in Farmington and Kirtland this week. So we have that to talk about as well. So there are the numbers. Again, we're taking those from ksje.com, and there's a lot of other things. Tomorrow we'll be checking the counties' graphs where they do kind of the 7-day average.
Yes.
And that's really where we can kind of see some of these trends. And so that has proved to be very helpful, I think, in kind of seeing the long-term trends of what's going on here.
It is helpful. And, it's easier to follow a line than do addition.
True.
I like the pictures.
Well, and the daily numbers are just up and down, up and down, up and down. And so it's really, the averages are easier to see. So that's good news. So we do have a caller.
Great. Let's do it.
Okay. Let's go to the phones. Good morning. You're on KSJE.
Good morning. How are you guys?
Hey, this sounds like
Friend of the
Liesl
show.
Dees.
It is.
Okay.
Nice to talk to you guys this morning.
Good to talk to you, Liesl Dees. And, of course, Liesl is with the Community Learning Center here at San Juan College, and all-around nice person. And
I think
that's how I can introduce her.
Yeah, that's definitely proved or an or.
Yeah,
Yeah.
I would say.
Never heard otherwise in this town.
No, not at all. But, Liesl, what's going on?
So I'm calling in once again, Scott, to report on the Want to Helpline. And as your regular listeners know, this was a cooperative effort between San Juan College, the City of Farmington, and San Juan County and the United Way to help people find opportunities to help others during this time.
Excellent. And that is still going strong, of course. And so what's the latest with the Want to Helpline?
So we are maintaining really 2 things. One is a website where you can go and find things that you can do to help others. And the other is that we have a hotline. I'm going to use my little air bunnies to say that. That we have a phone number that you can call and chat with us and tell us how you'd like to help. And most of what we'll tell you when we call is what you find on our website. And you'll find on that spreadsheet, Scott, that when you click the click here button, pulls up. We have 19 different opportunities on the website right now. We're always open to adding more as needs change, taking things off when they are no longer relevant, and happy to update that information on a regular basis. And there are a wide range of the 19 things that are on there. Some are on the Navajo Nation. Some are things that you've been encouraged to do for years, like donating blood. And there are periodic blood donations, like a drive that's going on at San Juan Regional that I heard about on your show, Scott and Megan. That's today and tomorrow. And things that you can do from home, things that you can do practicing social distancing, lots of different opportunities on there. And then the other thing that I want to let you know about is calling us, because as I said, we'll tell you about those things. But what we've discovered after doing this for about 8-9 weeks is that we periodically get phone calls asking for us to find people, and sometimes it's not we have days to post it on a website and hope that people find it. Sometimes it's a much more immediate need, like a phone call on Friday afternoon on a holiday weekend that we need to have people help with the testing at San Juan College on Tuesday morning at 7 o'clock. So if you call us ahead of time, we will call you back when we are looking for people. We'll go down our list of people who've called us until we find someone to fit those needs. So if you're someone who has extra time around, who also has access to other people, you're part of a Boy Scout troop, or you are part of a Sunday school class that has, for example, recent graduates who don't have a lot going on before they go to college and are staying home right now. Love to hear from you, and we'll put you on our list, and don't be surprised if you get a phone call back from us.
That's great. Can you give us an idea of some of the requests that you've had? Like, what's the weirdest request you've had?
Oh,
Thanks, Megan.
Sorry, Liesl.
yeah. No, that's probably just the most time sensitive. Most of what we hear, Megan, is actually predictably boring but necessary. So,
Right.
for example, Echo Food Bank once again needs volunteers. They shoot an email to the United Way. The United Way forwards it to us. We go down our list and we make phone calls.
Got
So-
it. Yeah.
Okay.
I know that at one point there was a request for like a storage facility for thousands of pounds of corn flour, for example. So I'm just, I mean,
Yeah.
I heard word on the street. No, but I mean, there's like a wide.
It's a lot of
breadth.
different things.
There's a lot of different
Yeah.
things, and so
Sure. And I know with all these opportunities, Liesl Dees, you all practice the safety measures and things like that. It's not like everyone's gathering to do some of these things without maybe masks or physical distancing and all those other things that we talk about, right? So even though you have these needs and these events that are going on for volunteers, it's all done safely and through certain procedures and what have you, correct?
That's the intention and goal. And I would say that when we're looking at information that people are sending us, that Echo, for example, has a very clear protocol. They've developed a volunteer form specific to COVID-19 that they want people to follow. It always comes down to people making good decisions themselves, too. So yes, we're looking at things where people are asked to follow the state directives to make sure that we are in compliance with the governor's health orders. We can't control whether someone gets out of their car at a food drive and makes it not contactless, right?
Sure.
Sure.
It comes down to
Right.
all of us to practice good pieces. And I know I personally have found that sometimes it's harder to practice 6 feet than than you think it should be.
Yes.
But it takes some personal accountability and responsibility to make sure that we are following guidelines and good common sense too. And that's what we're seeing in guidelines from the CDC, from epidemiologists. Recommendations as to what is best practice.
that's right. I love nothing more than personal responsibility
Yes.
and common sense.
I'm all for it.
All for it. So
Yes.
Scott and I had one question for you, which was, what are ear bunnies?
Air bunnies.
Air
Air
bunnies.
bunnies,
When you
but
take your
Oh.
fingers,
Yes.
okay, like a bunny ear, but in the air.
Right.
So it's
So-
like air
Air
quotes.
bunnies. Yeah, air quotes.
Yeah, if I could, it's like that.
Yeah, for the
But
for
they're like
listeners
bunnies.
who are also viewing.
The radio
Right.
listeners are not going to understand any of this, but
Sorry.
our viewers are going to maybe get.
I was totally.
that we're- yeah.
Man, all right.
There we
I'm
go.
the lost one. Okay.
Yeah.
Cool.
Air bunnies. Got a new term for you, Megan.
Thank
like
you.
it.
I love the new lingo too.
Learn something new every day on KSJE.
Absolutely, and I want to do a shout out to your radio audience because you should know that when I have in my infrequent visits to the grocery store, I've had people say, "Hey, I hear you on the radio these days."
Well, see there.
Both on KNMI and on KSJE. So
Well-
very glad to hear people listening and giving that feedback in the community.
We appreciate that they are doing that, and they're welcome to our world, Liesl Dees.
Yeah, I too have stopped frequently in the grocery store because I've been heard. Scott stopped a lot in the grocery store.
There you
but
go. I don't know. But anyway, I want to share the number. I don't know if we've done that yet.
I don't think so. Let's
On
do
the
it.
Want to Help line, because, of course, it is being so well used. And if you would like to sign up, maybe for a potential opportunity in the future, it is 566-4210. 566-4210, the Want to Help line. The website is accessible from the City of Farmington's website, fmtn.org. Then you can click on the link to go see the spreadsheet of all the available opportunities, as Lisa was mentioning. And then, of course, the Need Help line is that other opportunity if you're in need of services, and that is being put together through the San Juan United Way and others, and that's the 211 number that folks can call.
That's right.
So.
That's exactly right. And occasionally we'll get questions that really go to the helpline, the 211 number, and happy to send people to the right place. Megan, in addition to storage for hundreds, thousands of pounds,
thousands of pounds of corn flour.
Wow. Okay.
Go on.
I would say one of the other interesting things we've had recently are people calling us to get ideas for where they might want to donate their stimulus checks. Oh. And we're not in the business of referring people to one particular agency. The United Way is our partner, and they do have a COVID specific fund on this. But what we have been able to share with people are the needs that we know of in our community, both on our website, and if you look at the United Way's resources, it shows you a lot of the organizations and agencies who are helping other people. So, if people want to do something different with their stimulus funds or a portion thereof, you might get some ideas of things that speak to your heart by looking at that.
Right. And I mean, this isn't really a plug necessarily, but sometimes it's better just to give to the United Way because they know where the hot spots are, so they can divvy that up.
Well, and we had the United Way on the program not too long ago talking about their COVID fund.
Yes.
They were raising separate money specifically for COVID-19 relief.
That's right.
The money went to agencies that maybe aren't necessarily United Way agencies, but just other
Anybody
agencies
who applied.
Serving the need in the community.
Right.
So I do want to bring that up. And of course, full disclosure, I'm a board member of the United Way. Megan is a campaign chairman from United Way. Chairperson.
Chair, individual.
Chairperson.
Chair human. We're using our, what is it?
Air bunnies.
Air bunnies. Gosh, why do I keep saying ear bunnies?
Chairman.
Gosh, I'm going to have to get it together.
Yeah.
Anyway, it wasn't a plug specifically but
no,
there are funds out there that they've created
certainly.
Specifically for this. So.
And I think Liesl was mentioning, that we're not promoting anything, but if you're looking for a local impact, that may be one thing to take a look at.
And what a generous thing for people to do.
Yeah, that's wonderful, Liesl.
That's exactly right. Yep. And I think that's part of the joy of what we get to do is we get to see people who want to help and who want to give to others. I will say, too, that, as we're on week 11 now, that a lot of our lives have changed over time, too. And I was thinking about this as I was listening to Sue talk about the reach out to 5 people here. We probably all have people we check in on, and, maybe that high school senior has now graduated and they have more time, or maybe, your garden looks so perfect now that you're really ready to do something different. Even if you don't think that you're in the market for volunteering, say your day job has taken all that it can out of you right now, and it's exhausting to work so much remotely, and you don't want to do something else, add something else to your plate. But I bet we all have people in our lives who could really benefit from giving to others right now, who have a little extra time. We're all experiencing this in different ways and have different needs. And just being aware of the ways that we can help others is a meaningful thing.
That's absolutely true. So as we wrap up, Liesl Dees, do you have perhaps a song, maybe another new lingo that you could teach us?
Wow, nothing like putting her on the spot.
Yeah, I racked my brain for it, but I thought I was going to talk instead about groceries with you all and find out how long it's been since you went to the store and,
I love it.
What new shelf-stable items you've discovered.
Oh.
There's nobody else in my life that's keeping grocery store accountability for me.
No. And I'm, I've only,
where are you at, Scott, with that?
I go once a week, but I went yesterday. Sorry.
Wow.
Yeah.
Yeah.
Okay.
So.
Did you get things that'll last you a while, Scott?
Things that should last a while but won't in my house. But yes.
Like, for example, a bulk buy of cinnamon rolls?
Yes, because one of my coworkers seemed to really want cinnamon rolls brought to their workplace.
Yep.
So
I wonder who that would be.
If the roll fits,
if the roll fits, wear it.
Yes.
As he does air
Bunny
bunnies.
Club. Yeah, air bunnies.
Oh, man.
There you go. But anyway.
Wow.
But that's something we should be thinking about, Liesl. You're absolutely right. And
Bulk cinnamon rolls, yeah.
No, not that.
Okay.
Reaching out, grocery stores, shelf-stable items.
Right. Okay, got it.
Where are you, Megan? Let's change the focus of this conversation.
Let's go ahead and switch this up.
To my beloved co-host.
We're still an Eggo waffle. We're very Eggo waffle heavy at my home.
Okay.
And I don't partake in this, but the teen that lives with me is a huge fan of Hot Pockets. So you
those
know,
last forever.
Those you can probably stick outside and come back to in about 4 weeks, and you'd still be safe. So that's, I mean, there's nothing more shelf stable than that, right? You got to coat it with enough preservatives. See, I bet at the end, Scott, all of the preservatives that I take in my body, maybe I'll last longer. Who knows?
Well, there you go. Liesl, are you still with us, or have you hung up in disgust?
Of course I'm with you, Scott.
Okay.
Yeah, always looking for the opportunity to chime in, but sometimes you two leave me speechless.
Well,
we've been told.
We hear that a lot. Yeah, we really do. So there you go. Well, Liesl, thank you for your advice, and it's stuff that we should all be striving towards, really. And so,
Thanks for carrying the torch, Liesl.
Yeah, we appreciate that.
Well, thank you all for having me on, and I'll call you back in a few weeks.
All right, we'll look forward to the next update on the Want to Helpline.
Right.
So thank you very much. That is Liesl Dees, everyone, from the Community Learning Center here at San Juan College, and of course, lots of other great just ways to live our lives in a healthier, better, sustainable way.
She's a pro at that.
She really is. It's
I know,
true.
she is.
Yeah.
Yeah.
Just if I could do 1% of the things that she does.
We'd be healthier if we had a pie chart.
Right.
Yeah.
I know, but there you go.
But we're just going to keep eating our cinnamon rolls over here.
Well, there you go. Maybe we'll park a little further away from the studio tomorrow for more exercise.
There you go.
Little baby steps.
What if we challenged each other to plant something, like a vegetable or something outside? What if this becomes like our thing now? At the end of every show, we give like an update. Like, Scott, what was the healthy habit that you did yesterday? Megan, what was the healthy?
Yeah,
it might be
okay. Well,
good for us.
We'll revisit that.
Okay.
Okay.
Cool.
I think great. Can't wait for that. Looking forward to it.
We'll do baby steps first.
Yeah.
Yeah.
I think that's a good thing.
That's wise.
Okay. Very good. All righty. Well, anyway, we are out of time. Tomorrow on the show, we could talk about, we're going to be speaking with some of our favorite doctors from San Juan Regional Medical Center about the updates on some of the medical information that we're hearing about, right? What's the right stuff, because it's changing. And I know folks get confused, and I get confused when people are posting old stories on Facebook, and I point that out, and I'm like, how helpful is this when it's 2 months old?
You can't refrain.
I really can't.
Yeah.
I don't. I should, but I don't.
Scott Micklin, patron saint of
Facebook
social
police.
media
And I know
policing.
people can post whatever they want.
That's right. But it is, to your point,
if it's out of date and misleading,
helpful.
I have a problem with that.
Every Thursday, it's very helpful to have somebody who knows what they're talking about bring in this voice of reason.
Right. She's not talking about us. She's talking about our guests.
I'm definitely talking about our doctors.
Exactly. So we're going to talk about that. We're also going to have someone from Presbyterian Medical Services on tomorrow, is the plan, to talk a little bit about what they're doing with their population, and how a local hotel is kind of stepping up to help with that. So we'll get more details about that tomorrow on the show. So we hope you'll join us then, everybody. Again, live, Facebook and YouTube at 9 a.m. and rebroadcast every afternoon at 5:06 p.m. And, of course, we thank KNMI for broadcasting the audio at noon on their radio station as well. So, very good. So until tomorrow, everybody, have a great Wednesday. We will see you back here tomorrow on Thursday, KSJE.